I'd like to welcome Professor Leila Abid, Professor and Chairman of the Cardiology Department at Sfax University, and she is the past president of Tunisian Cardiac Society, and she's one of the experts in the field of heart failure in the region. So I'd like to ask you, Professor Leila, the collaboration between the national heart failure societies representing the European Society of Cardiology. Today we have a distinguished group of experts from the region to gather here to discuss what's new in heart failure. So what's your impression regarding this collaboration, especially in our region? We have a lot of problems regarding the management of heart failure, the outcome of patients, the implementation of the guidelines. So I need to know your opinion about this.
Thank you, Dr. Magdi, for this kind invitation, for this wonderful and fantastic meeting dealing about heart failure. And I'm amazingly surprised for the quality, scientific quality of the meeting, with the presence of experts from European Society of Cardiology, from Egyptian Society of Cardiology, from Tunisia, Emirates, Lebanon. And I think it's a good, this collaboration is a good thing for cardiologists from Middle East and North Africa, because we have common problems. And I think that it's interesting to have a meeting to share our experience, to discuss the news in cardiology field, but I think that we should think to elaborate together Middle East and North Africa guidelines, because I think in some fields we have our specificities. So I think we should go to the second step after sharing experience to together elaborate our guidelines, our recommendation based on our data, because I know that you have your own heart failure registry, for example. We have our own Tunisian registry of heart failure, which was published recently in heart failure, but in hypertension, in coronary artery disease. So based on our data and our specific feature in the field of cardiology, we should have our guidelines.
Excellent. I have another question. You presented a very interesting presentation regarding the diagnosis of acute heart failure and how to assess congestion in acute heart failure. So the role of biomarkers is very important, and unfortunately I think in the region there is underuse for the NT-proBNP and biomarkers in diagnosis of heart failure. So how can we follow the guidelines to do NT-proBNP in the ER for every patient coming with possible diagnosis of acute heart failure?
If I give you the percentage of patients in Tunisia who had peptide natriuretics for diagnosis of heart failure in our Nature EGYHF registry, it's about 3% only. And more than 50% of investigators work in public center. So the dosage of the natriuretic peptide is a bit expensive in Tunisia. I think it's the same thing, for example, in Egypt. In reality, in our clinical practice, we can't follow exactly the European guidelines. In our practice, we do the echocardiography as the first exam to diagnose heart failure, to evaluate heart failure congestion, and after that, if necessary, natriuretic peptide. But we have rare cases where we begin with natriuretic peptides, taken based on the price of the biomarkers.
Thank you very much, and again, thank you very much for your excellent contribution to the program of the meeting. Thank you.